Hello everyone, I am urologist Omar Makaya. Today we will talk about whether penis enlargement drugs really enlarge the penis. Let me say it clearly right at the beginning of the video, friends. Unfortunately, penis enlargement drugs do not enlarge the penis. I have not yet had a single patient who has come to me saying that his penis has enlarged by using penis enlargement drugs. But I had many patients asking me why his penis didn't enlarge even though he used these drugs. So why are these drugs sold on the internet? Obviously, people take and use them hoping, but unfortunately the results are negative. I can say that these drugs generally contain substances that increase the blood supply to the penis. The active ingredients of drugs like Viagra and Cialis are illegally put in these drugs that are sold on the internet. And this can make the penis look more bloody and alive, fuller and bigger when it is in its descended state, friends. But it should be said that it does not provide any enlargement. And there are two types of penises. When they're not erect, one looks like a squeezed sponge. The other is bloody and alive even when it's in its desiccated state. When stretched, these two penises are actually the same size, but in their descended state they are different sizes. For example, the patient says that his penis has shrunk. But what actually happened is that his penis was more bloody and alive when it was descended, but now it is contracted. There are two reasons for that. The first reason is that the patient gained weight in a short time. Thus, the penis has become intertwined with fat. It seems to be small in size. Or there are problems in the health of the person's end arterial cardiovascular system. Or the hormone mechanism has started to deteriorate, or there is a problem in the intake of micronutrients. There can be many reasons why the penis is so shrunken and small. It is necessary to say that erectile dysfunction, premature ejaculation and sexual function problems are more common in patients with a small and shrunken penis. So, can penis enlargement be achieved with drugs? Under normal conditions, yes. Yes, but with hormone interventions at or before puberty, it is possible. But what we mean by puberty, that is, if a person's male type and shape body form has been formed, after that time, it is very difficult for you to achieve penis growth with any hormone therapy. Very rarely, in patients with delayed puberty, penis enlargement can be achieved with drugs after the age of 20. I've made a video before about how long the penis continues to grow. Penis growth starts at the age of 10 to 12, ends at the age of 16 to 18 and very rarely continues until the age of 20. As I said, the fastest penis growth can usually occur between the ages of 12 and 16. In the period before and after that, it continues to grow slightly. How can penis enlargement happen after that age? Surgical operations can be performed. In the surgical operation, the ligament that separates the root of the penis from the bone is cut to lengthen the neck of the penis. Like here, there is a ligament between the bone and the penis. When we cut this, the penis hangs down and becomes a little longer. When the skin here is cut and sutured in this way, some cosmetic lengthening is achieved. At the same time, the penis can be made thicker by performing operations such as filling materials, fat injections, or artificial tissue grafts. I have a page about penis enlargement. I will put the link below. You can look at the surgery photos in detail there if you want. That's all about penis enlargement drugs. Thank you for listening, best regards.